All right, so let's dive into something pretty intricate but super relevant to you all out there in public health. Complexity theory.
Okay. Yeah.
And, I know you're all familiar with the idea that health issues, they're rarely simple, right?
Right.
But today we're really going to kind of explore how this web of interconnectedness, how that actually plays out.
Yeah, that's right. I think we're going beyond, just acknowledging that things are complex and actually diving into okay, how can understanding these complex systems actually lead to more effective uh, research and interventions?
Exactly, yeah.
Yeah.
And I think for anyone who's ever felt like traditional research methods, um, they just weren't capturing the full picture. Like this is going to be eye-opening for you.
Yeah, it really is. I think of it this way. Traditional research often tries to isolate variables, right? To find those clear cause and effect relationships. But in complex systems, everything's influencing everything else,
Right.
So it's less about isolating and more about understanding the interplay.
Okay, so before we get ahead of ourselves, I think let's start with the basics, right?
Yeah.
What exactly makes a system complex in the first place?
That's a great question. There are a few key characteristics that I think set complex systems apart. One is what we call emergence, right?
Okay.
It's this idea that the whole is truly greater than the sum of its parts, right? The behavior of the system as a whole can't be predicted just by studying the individual components in isolation.
So it's like trying to understand like the behavior of a flock of birds just by studying a single bird in a cage.
Exactly. Yeah, that's a great analogy, like the flocking behavior, right? The
Yeah.
the patterns that they create emerge from the interactions of all those individual birds, right?
Right.
And you wouldn't see those patterns by just studying one bird.
That makes sense.
Yeah.
So what else makes a system complex?
Another key characteristic is the presence of what we call feedback loops, right?
Right.
So in a complex system, um, actions or changes within that system can trigger, like a ripple effect, either amplifying the change, so that we call that a positive feedback loop, or dampening it, which would be a negative feedback loop.
Okay, I can see how this is relevant to public health,
Right.
right?
Yeah.
So if we try to intervene in a complex system like those feedback loops, they could either help our intervention along or create unintended consequences.
Absolutely. Yeah. And it can be really hard to predict which way those feedback loops will go, right?
Right.
Which is why the systems perspective is so important.
So emergence and feedback loops, what else should we know about the hallmarks of complex systems?
Right. So I think finally, complex systems are constantly adapting and evolving,
Okay.
right? So think about how an ecosystem responds to changes in the environment, right?
Right.
Or how like a virus mutates to evade our immune systems.
Okay, so we've got systems with emergent properties, um, feedback loops that can either help or hinder us, and this capacity for adaptation. But how did this whole idea of complexity theory even come about?
Yeah.
It seems like a pretty significant shift from traditional scientific thinking.
It is, and actually, it emerged gradually, I think, from various fields. In physics, for example, as scientists started studying systems with huge numbers of interacting particles, right?
Right.
They realized that classical mechanics, with its sort of neat and predictable laws, it wasn't sufficient.
Yeah.
You couldn't predict the exact movement of every molecule in a gas, for example,
Right.
but you could start to see patterns emerge at a larger scale.
So they had to shift from deterministic thinking to a more probabilistic understanding of how these systems work.
Exactly.
It's sort of like the difference between trying to predict the path of a single raindrop versus understanding overall weather patterns, right?
Exactly. And similarly, in biology, as scientists delved deeper into the complexity of living organisms, they realized that simply breaking things down into their smallest parts, it wasn't enough to understand how life really worked, right? Like
Well,
the interactions between those parts, the networks they formed were just as important.
So complexity thinking was sort of brewing in these different fields, but when did it all come together as a distinct field of study?
Right. That really started to happen, I would say, in the mid 20th century, with the rise of what was called cybernetics,
Okay.
which focused on control and communication in both machines and living systems.
Okay.
So these cyberneticians, they were fascinated by feedback loops, self-regulation, and how information flows through complex systems.
So they were starting to see the parallels between how machines work and how biological systems, even social social systems
Yeah,
operate.
exactly. And then, in the 1980s, the Santa Fe Institute was founded specifically to study complexity.
Come on.
And this brought together, scientists from all sorts of disciplines, physics, biology, computer science, economics, you name it, right?
Wow.
To try to understand, how these complex systems work.
Sounds like the perfect breeding ground for some truly interdisciplinary breakthroughs.
It was, and that's when, complexity theory really started to take shape as a field.
So we've got this convergence of ideas from different disciplines.
Right.
And they're all kind of pointing to this idea that the world's made up of interconnected dynamic systems, right?
Right.
But how does all of this relate to public health?
Yeah, in a very real and practical way. Because when you think about it, public health is all about understanding and influencing complex systems. We're not just dealing with individual patients, we're dealing with populations, communities, environments, policies, all interacting in complex ways, Like think about something like the obesity epidemic, right?
Right.
It's not just about individual choices, right?
Right.
It's about food environments, social norms, economic factors, marketing strategies, even urban planning.
Right.
All these interconnected pieces.
So instead of just focusing on getting individuals to eat less and exercise more, like a complexity perspective would say, okay, well, let's zoom out and look at all these other factors that are shaping people's choices.
Exactly. Yeah. And that's where I think the real power of complexity theory comes in for public health is that, it gives us the tools to start mapping out these complex systems, to identify those leverage points where we can intervene more effectively.
Okay, so we've laid the groundwork, right, for what complex systems are, where this idea of complexity theory even comes from. Now let's talk tools.
Yeah.
So what are some of the ways that researchers can actually study these systems?
Yeah, that's a great question. So one really powerful approach is what we call system mapping.
Okay.
And it's essentially about, creating a visual representation of that system, showing all the different components and how they're connected to each other.
So it's like drawing a map of this system.
Yeah.
But instead of roads and landmarks, we've got all these different factors and relationships.
Precisely. Yeah. And there are, different types of system maps you can create, right?
Right.
So you might have what's called a causal loop diagram,
Okay.
which highlights those feedback loops we were just talking about.
Right.
And it shows how changes in one part of the system can, sort of ripple through and affect other parts.
So with a causal loop diagram, you could start to see how, say, a policy change aimed at reducing sugary drink consumption might lead to unintended consequences in other areas.
Exactly.
Yeah.
Or, you might use what's called a concept map, right?
Okay.
To capture a broader range of connections between different concept for factors, right? So it gives you a more sort of holistic view of the system.
Okay, so system mapping helps us kind of visualize these complex relationships.
Right.
What other methods are out there?
Yeah. So another really valuable tool is what we call system modeling, right?
Okay.
And this involves using computer simulations to actually explore how a complex system, might behave under different conditions.
So it's like creating a virtual laboratory where you can test out different interventions and see what happens.
Exactly. And again, there are different types of system models you can build. Right. So you might have what's called an agent-based model, where you actually simulate the actions and interactions of individual agents within that system.
Okay.
So in the case of obesity, for example, right?
Yeah.
You could create a model where each agent, represents a person, right?
Right.
And they make decisions about, their diet and exercise based on all the various factors in their environment.
Right. So by changing those environmental factors in the model, you could actually see how those changes might ripple through and affect the overall health of the population.
Exactly. Yeah.
Okay, that sounds incredibly powerful.
It is.
Are there other types of system models that researchers use?
Yeah. So another type is what's called a system dynamics model.
Okay.
And this focuses on the relationships between, different variables in that system and how those variables change over time. Right. And so these models are often used to study things like, population growth, resource depletion, or the spread of disease, for example.
Well, the system dynamics model could help us understand how something like Like an aging population might impact healthcare costs
Yeah.
or the demand for certain types of services.
Exactly. Yeah. So by modeling these complex interactions, we can start to anticipate, future challenges and develop more effective policies and interventions.
This is all incredibly insightful.
Yeah.
So we've got these tools to map and model uh, complex systems. Now let's bring it back to the real world.
Yeah.
What are some like concrete examples of how complexity theory is being applied to improve public health?
Yeah. So one area where I think it's making a really big impact is in understanding and addressing health disparities.
Okay.
Right. So we know that there are these persistent, gaps in health outcomes between different groups.
Mm.
Right. And these disparities are often driven by, complex interactions between social, economic, and environmental factors.
Right. It's not just about individual um, behaviors or genetics. It's about the systems that people live in, right?
Exactly.
The opportunities they have access to, the barriers they face.
Exactly. And complexity theory, I think helps us untangle those complex relationships. So, for example, researchers have used system mapping to try to understand the factors that contribute to racial disparities in infant mortality.
Wow.
Right. So they've looked at things like access to prenatal care, neighborhood conditions, stress levels, even historical trauma,
Right.
and how all of these factors sort of interact to influence health outcomes.
So it's about moving beyond just looking at individual risk factors
Hmm.
and seeing how those factors are embedded within these larger systems of inequality.
Precisely. And by I think by understanding these systems, we can start to identify again, those leverage points
Yeah.
where we can intervene more effectively to reduce those disparities.
Okay, so that's one example. What other areas of public health are benefiting from a complexity perspective?
Yeah. So another big area is in the design and implementation of public health interventions, right?
Mhm.
So traditional interventions often take what we call, like a one size fits all approach,
Right.
right? But we know that, people are different, communities are different, and contexts are different.
Right. What works in one setting might not work in another.
Exactly.
Yeah.
Yeah. And even within a single setting, different people might respond differently to the same intervention.
Right.
Right. So complexity theory encourages us to move away from these kind of rigid, top-down approaches and
Yeah.
towards more flexible, adaptive intervention.
Yeah.
That can be tailored to specific contexts and populations.
So it's about recognizing that we're not dealing with static systems,
Mhm.
but with dynamic, ever-changing webs of relationships.
Precisely, yeah.
Okay.
And that means being willing to iterate, to learn from our experiences, and to adjust our interventions as needed.
This all makes perfect sense, but I'm wondering, like, how do we even begin to measure something as intricate and multifaceted as complexity?
Hmm.
Is there like a complexity yardstick we can use?
That's a great question, and one that has, puzzled scientists for a while.
Yeah.
There isn't a single universally agreed upon way to measure complexity perfectly.
Yeah.
It's a bit like trying to measure, creativity or happiness. There are different dimensions to consider.
So it's not like we can just slap a number on it and say, okay, this system, it's got a complexity of 7.2.
Right, exactly. But we can look at different aspects of a system to get a feel for how complex it is, right?
Yeah.
So one way is to simply count the interacting parts.
Right.
And generally speaking, more parts and interactions means more complexity.
So like a city is inherently more complex than, say, a rural village,
Yeah.
just by the sheer number of people and things going on.
Exactly. But it's more nuanced than just counting, right?
Yeah.
The type of interaction matters too.
Yeah.
So if everything acts in a very predictable, linear way, it might not be that complex, even if there are lots of parts.
Like a basic machine with lots of gears, right? Like complex in design, but each gear's function is pretty straightforward.
Precisely. Yeah. Yeah. Another angle is how the system behaves.
Well,
Right.
yeah.
So does it show emergence where the whole is greater than the sum of its parts? Does it adapt and evolve over time?
Right.
Are there those feedback loops we talked about, right? Amplifying or dampening changes?
So a system that can learn and change that's inherently more complex than one that's just static. Like comparing a a living ecosystem to like a rock formation,
Yeah.
right? Like one's constantly adapting, the other one's pretty set in its ways.
Exactly, exactly. And there are, mathematical tools we can use to try to quantify some of this.
Okay.
Things like, entropy, which measures disorder or randomness,
Right.
and what we call network measures, right? That can capture how interconnected things are.
So we can get a sense of complexity, even if pinning down one exact number is kind of tricky.
Right.
But for someone working in public health, right? Like how do they put this into practice? Because it feels very, very theoretical.
It is a shift in thinking, for sure.
Right.
But, imagine you're tackling something like, say, vaccine hesitancy, right?
Okay, yeah.
If you just view it as people making individual choices, you miss a lot,
Right.
right? Complexity thinking makes you map out all the influences,
Yeah.
things like social networks, misinformation sources, trust in institutions, and so on.
So instead of just crafting like a single message, you're considering how that message will interact with this whole web of factors.
Right.
Some of them reinforcing it and some of them working against it.
Exactly. Yeah. And you design with that in mind.
Right.
Right. So maybe you partner with community leaders that people trust, or you try to target misinformation specifically where it's spreading. Right.
Right.
So it's a much more sort of dynamic approach.
Yeah, this has been a real deep dive. Any last thoughts for our listener out there probably trying to apply this to their work?
Yeah, I'd challenge them to actually try a system mapping exercise, on a current project that they're working on. Who are all the stakeholders? What are the boundaries of the system?
Yeah.
And just seeing those connections visually, I think, can spark some really new insights.
Great advice. And remember, this deep dive is just the beginning. Complexity is a vast, fascinating field. Keep exploring, connecting those dots, and diving deep into the systems that impact your work.